All right, so we're going to get started with sports massage. We're on chapter 18, page 686 and 687. The first page of this chapter is just like learning objectives and stuff. So we're going to move on to the next page, which is where this information actually really begins. So we're on page 688. Now, before we jump into sports massage, there's a couple of things that I just kind of want to mention. First of all, sports massage is its own modality. Most of the techniques that it uses is going to be pulled from Swedish massage. So you are using strokes like effleurage and petrissage, compression, tapotement, jostling, chucking. But what makes a modality is the intention of the modality. So we may be using the same techniques from Swedish, but what we are doing is not Swedish. The intention makes the modality. So with sports massage, we have particular goals in mind, particular outcomes that we're trying to get out of the body when we're massaging it. So to use the same techniques will change the modality. Remember, it is what we are intending to do. What are we trying to accomplish that determines what modality we are using. At the beginning of your chapter, in the introduction, I want you to highlight the very first line of the second paragraph. This is something important for us to know. In 1984, for the first time, sports massage was made available for all athletes competing in the Summer Olympic Games in LA. 1984 was when we first started seeing massage being offered to athletes. And as you guys may or may not be aware, once something catches on with the athletes, it is only a matter of time before that trend starts to spread throughout the population. We have seen it in our modern times with kinesio taping. We've seen it with cupping. So in the 80s, it was massage itself. So this is really one of the key events that kind of launched massage into the public eye. So when we're looking at the purpose of athletic massage enables athletes to attain their highest potential by accelerating the body's natural restorative processes, enabling the athlete to participate more often in rigorous physical training and conditioning. So the whole purpose of athletic massage can be broken down into three key points. The first key point is sports massage allows the athlete to train harder. How? The second point is by reducing recovery time. So if I train really, really hard, but it takes me 2 or 3 days to fully recover from that workout before I can get back out there and work out again, if sports massage is reducing my recovery time, then I may be able to go work out in a day or two, which means I can fit more workouts into my week, which means I can train harder, which also means, the third point, it improves my performance. So I can train harder, I'm reducing my recovery time, and I am improving my performance in my sport. Now, for the average Joe, like if you or I were to jump on a bicycle and go for a ride, this doesn't really make a whole lot of difference to us. But if you are a professional athlete and your body is your instrument and this is your moneymaker and competing in one of these sports is how you make your living, then being able to train harder, reducing your recovery time, improving the performance of your sport, this is directly tied to your income. So it makes a lot of sense for professional athletes to pay decent money for a qualified sports massage therapist to see them multiple times a week. So let's catch up on a couple of highlights. Under Explain the Purpose of Athletic Massage, hey Whitney, page 688, under Explain the Purpose of Athletic Massage, it says, athletic massage, also called sports massage, is the application of massage techniques that combine sound anatomic and physiologic knowledge and understanding of strength training and conditioning and specific massage skills to enhance an athlete's performance. Highlight, Athletic massage enables athletes to attain their highest potential by accelerating the body's natural restorative processes, enabling the athlete to participate more often in rigorous physical training and conditioning. Pause highlighting. Massage helps to reduce the chance of injury by identifying and eliminating conditions in the soft tissue that are potential risk of injury. So there is a fourth important point. Sports massage reduces your risk of injury by maintaining the stretchy, supple nature of your muscles. We reduce the risk of injury through things like chronic muscle tension or loss of range of motion. When an injury has occurred, highlight, massage helps to restore mobility and flexibility to injured muscle tissue while reducing recovery time. Athletic massage, when performed correctly, can improve the athlete's ability to perform while reducing the incidence of lost time from injury and fatigue. Keep highlighting. Adaptive sports massage, or sports massage for athletes with disabilities, is a specialty that requires additional knowledge and training in the disabilities that these athletes have. So, sports massage is not just for your highly competitive athletes. Anyone who has watched the Special Olympics, those Olympians get sports massage too. We're going to slide down to the bottom of the page. The very last paragraph, you get like 2 lines of it at the bottom of the page. I want you to highlight the first sentence. Athletic massage is not just reserved for the highly competitive athlete. Even those so-called weekend warriors could benefit from a sports massage. These techniques are effective on any active person. So if I want to be a sports massage therapist, right? I understand now the benefits of sports massage. We train harder, we reduce recovery time, we improve performance, reduce the risk of injury. What else do I need to know as a massage therapist? Well, number one, and probably one of the most important, is we need to have a solid understanding of kinesiology. Kinesiology is the study of muscular activity and body movement. So how do muscles contract? How do they work? How do they take in nutrients? How do they get rid of wastes? What can I do to improve the functional capacity of a muscle? The second thing we need to be pretty well versed in is biomechanics. Biomechanics studies the body movement overall. So kinesiology is generally limited to one muscle or one joint, and what can this one joint do? Biomechanics looks at the movement of the whole body. How many different positions can this body move into? How does this body need to move in order to operate most effectively or most efficiently? So, an understanding of kinesiology, which is the study of body movement, helps the therapist recognize which structures are involved in movements of particular skills, especially
I can't hear it.
when he's present.
Saying.
Can you hear me?
We did call it, didn't go in.
Do what? Do what? I'm sorry, you broke up. Whitney,
Did try to.
I'm hearing Roxanne, I think. Roxanne, can you hear me? Papa, can you hear me? Okay.
Can you hear me?
I can hear you. Can you hear me?
You're going in and out, so I'm hearing very little bits, but I can, yeah. Right now, it's good.
Cool. I'll do the best I can. Sorry.
Yeah. We'll take what we can.
Right. So, on page 689, there are 2 words. They are in italics. I want you to make sure you've highlighted those in the text. Kinesiology and biomechanics. Highlight those. We're on page 689. Highlight those. Kinesiology, study of body movement. So especially when we're working with athletes, we need to know what kinds of movements are involved in their sport, what joints are involved, which muscles are active, so that we know what to focus on in that massage. Biomechanics is the study of the integrated movement of the body overall. A couple of other things that we need to be aware of as sports massage therapists are the principles of endurance and overload. Now, if you've ever worked out, ever in your life, you're probably familiar with these, but let's go through them. Endurance is defined as the act, quality, or power of withstanding hardship or stress. So when we talk about endurance, it's your ability to maintain some kind of physical output. What I mean is, myself, I will let you know right now, if I had to run, I might make it a block, and then I am out for the count. I am not a runner. If I am running, something is wrong, and you should run with me because something's chasing. Endurance is the ability to run for really long times or to maintain. In order to grow and develop muscles, we have to take into account the principle of overload. What you have to do is stress the muscle to the point where it won't function anymore, almost to that point. Then you let it rest, you let it recover, and then you push it again.
Okay.
Each time, right, if we were going to put on a graph how strong this muscle is, right, in the beginning, you peak somewhere around here, and I'm just making this up just to illustrate the point. So in the beginning, you peak somewhere around there, but you keep working out, you keep pushing it, you keep using your endurance to push yourself further and further. Well, as you continue working out, pretty soon you'll be able to peak higher and higher. This is overload. The principle of overload states that by applying stresses that are greater than those which the body is accustomed, so you push yourself more than you're used to being pushed, you force the muscle to adapt to heavier and heavier loads. This is why you cannot pick up weights, right? If you're going to lift weights, you can't lift the same weight every time. Eventually, you're going to get used to it. Those 40-pound weights won't be a challenge for you after a while. You got to go to 45s and then to 50s and then 55. Because once your muscles adapt to that 40-pound weight, they're not going to grow anymore. You're not developing your endurance. You're not overloading the muscles. So by overloading the muscle, you force them to strengthen themselves. That is how you're able to lift heavier and heavier loads. So make sure you're highlighting the definitions in the margin, endurance and overload. I also have a few lines in the text that I want you to highlight. Starting on the third paragraph on page 689, highlight an accepted principle in sports physiology is that to improve either strength or endurance, appropriate stresses must be applied to overload the system, forcing the body to adapt to the heavier load. We're going to skip the next couple sentences, move down to the next paragraph. Highlight, during intense training, competition, and sometimes in activities of daily living, muscle strength and endurance are pushed beyond their limit. The result can include the following. Highlight all those bullet points. Overloading muscles will increase metabolic waste buildup in the tissues. This is a very technical sound. Oh, metabolic waste product. When you push cells to do a lot of work, they need energy. Just like you and I need energy. When I need energy, I eat a lot. So when you push your muscles to do something, they consume more energy. Well, if I eat a lot more, I'm going to be pooping a lot more too. So when muscle tissue or cells increase their metabolic rate, they increase their intake of nutrients, they also increase their output of waste products. The waste products go into the bloodstream. Hence, a buildup of metabolic waste products. We're talking about cell poop, you guys. Number 2, strains in the muscle or connective tissue. When you push muscle, it damages the muscle slightly, just slightly. But it is that microscopic trauma, that microscopic injury that allows the muscle to rebuild stronger. This is how you develop that, you overload the muscle to develop its strength and develop endurance. Inflammation and spasms and pain that restrict movement. So these are things that will occur when we push the muscle beyond its limits. We just described all the side effects of exercise, by the way. So what are the beneficial effects of athletic massage? Highlight that very first sentence. The goal of athletic massage is to enhance the athlete's performance. That is it in a nutshell. What are we doing with sports massage? Improving an athlete's performance. We want the athlete to be able to perform better, faster, with less chance of injury. If they do get injured, we reduce the amount of downtime that they are suffering from that injury. Some of the more beneficial effects of athletic massage is the creation of hyperemia. This is a term that we should be familiar with by this point. Make sure I got space. I'll put it up here. Hyperemia. Hyper means above or an increase, a lot of something. Em means blood, and ea indicates a condition. So hyperemia is literally a more blood condition. Hyperemia is when we are pulling blood into the tissues. We know that this is happening because the tissue turns red. If you've ever done a really intense massage or worked an area for a good while, you've noticed the skin starts to flush red. That is hyperemia. It is a good sign. Bringing fresh blood to the tissue means that we are bringing nutrients and oxygen into the tissues. And the other thing to keep in mind, blood circulation is one way, right? And it never stops. So if we're bringing fresh blood in, that must mean that we are pushing old, stagnant, dirty blood out. So by creating hyperemia, we are increasing circulation. We are bringing nutrients and oxygen into the tissues. We are promoting the removal of metabolic wastes. We also reduce muscle spasms. We enhance circulation to local tissues. We are identifying areas of muscle tension and then treating those areas of tension. We help break down adhesions, like sticky spots in the muscle tissue where those muscles are supposed to be sliding past each other. We reduce fibrosis and reduce adhesions, like muscle knots, adhesions. We can do massage over newly formed scars, which reduces the fibrosis in that scarring. It makes the scar tissue looser and more pliable so that it doesn't restrict the tissue movement. So as I said in the beginning, the techniques that we use in sports massage are almost copied and pasted from Swedish. The difference is the intention. So when we are looking at the techniques of athletic massage, a lot of these we're already pretty familiar with. So I'm not going to spend too much time on them. The very first one that your book lists is compression. A very, very beneficial technique. Compression works wonders. It's a very simple technique, right? Compression is the simple push and squeeze, push and squeeze, push and squeeze. Under compression, I want you to highlight compression is applied with a rhythmic pumping action to the belly of the muscle. The most important goal of compression is to create hyperemia in the muscle tissue. Deep compressions stretch, broaden, and separate muscle fibers, and in the process, release histamines and acetylcholine. Stop highlighting there. Histamines and acetylcholine cause blood vessels to dilate and get larger, which pulls more blood into the area. When you have more blood, you have hyperemia, a more blood condition. The next technique that we use is deep pressure. On page 691, I want you to highlight deep pressure is usually applied with a braced thumb. Would look like this. A braced thumb, you're using your thumb tip as your tool, but you've braced that thumb against the rest of your fingers so that as you apply pressure, you're not just leaving your thumb all out by itself. We brace that thumb so that we don't overwork the joint. Braced thumb or braced fingers. We could apply a massage technique with braced fingers. We would manipulate the tissue like that. The forearm or the elbow. All of these are great tools for deep pressure. Deep pressure is also referred to as deep static touch. Static touch is when you apply pressure and you leave it there. You're not moving your hands around, you're not moving the tissue, you just push deeply and hold. We also call this ischemic compression or trigger point pressure technique. All of these names, you're doing the same thing. You're applying pressure to the body and you hold the pressure there. You don't move the tool around, you just push and hold. Now, with deep pressure, this is going to be kind of our springboard into talking about trigger points. We will be talking more about trigger points when we get to the neuromuscular section, so we're going to save most of that for later on. But trigger points are a unique phenomenon. These are discrete phenomena that occur within the muscle, meaning a trigger point is a physical thing in the muscle. We can take biopsies of the muscle tissue, look at it under a microscope. You can visibly see the trigger point in the muscle tissue. The defining characteristic of a trigger point, like the one thing that makes it a trigger point, highlight in your text next to trigger points. If pressure on a point causes pain to radiate or refer to another area, that point is considered to be an active trigger point. That is almost the definition of a trigger point. So many things, when you press on them, they hurt. But trigger points are unique. When you press onto a trigger point, it hurts. And it refers pain to some other area of the body. Common examples are, here you can see my SCM muscle. Trigger points in the SCM muscle, when you press on them, refer pain up through the side of the head, up into the scalp or into the face. That phenomenon of pain spreading or being triggered in some other area distant from where the pressure is being applied, that is a trigger point. Trigger points are found in tight muscles, and we can release them using trigger point pressure technique. We will talk about that, like I said, when we get to the neuromuscular section. So the way that we generally treat trigger points is once you've identified the trigger point, so I know where it is, you apply pressure, and you ask the client, how would you rate this pressure on a scale of 1 to 10? With 1 being just the weight of my hand, like no pressure at all. 10 being excruciating, it hurts too bad, you got to stop, I can't take it. For a trigger point pressure release, we are wanting a pressure on the trigger point somewhere between a 5 and a 7. So if a 1 is no pressure at all and a 10 is excruciatingly painful, we want about a 5 to 7. You will apply pressure, hold, then release. And then you apply pressure again, hold, release. And every time you do that, your pressure doesn't change, but the client reports that they feel a lessening in the pressure. So after you've done this several times, and it will take a few minutes, but after you've done this several times, you're still applying the same amount of pressure, but they will feel the pressure instead of 5 to 7, they'll feel it as like a 2 or a 3 or a 4. So once you've elicited that reduction in the sensation that the client's feeling, we know that the trigger point is on its way to being deactivated. Another technique that we use a lot in sports massage is transverse friction or cross fiber friction. You guys will recall from your Swedish 101 days, transverse friction is when we are going against the grain of a muscle. So if the muscle fibers are running in one direction, we apply pressure and move the tissue against the grain of the muscle. Friction, remember, we are taking the skin with us. So we are moving our hands in the skin as a unit. We are not gliding over the tissue. This is not effleurage. This is friction. So in your books, at the bottom of 691, transverse or cross-fiber friction is a deep myofascial technique that is applied by rubbing the fibers of the tendon, muscle, or ligament at a 90-degree angle to the fibers. For those of you who are not math whizzes, I'm not a math whiz, but 90 degrees is directly straight across, like strumming guitar strings or stringing the strings of a violin. Highlight. The use of transverse friction for treatment of soft tissue lesions was popularized by the British osteopath Dr. James Syriac. Cross-fiber friction effectively reduces fibrosis and encourages collagen proliferation to promote the formation of strong, pliable scar tissue at the site of healing injuries. So again, we would generally use the fingers or braced fingers, a braced thumb. We could even use forearms and elbows. But the important factor here is that we are moving our hand with the skin. The skin is moving as a unit over the underlying structures. We are not gliding over the skin like effleurage. More techniques that we use are shaking and jostling. So shaking is exactly what it sounds like. You take the client's limb in your hands and you just give the limb a good shake. Jostling, on the other hand, is when you take the tissue and you move it side to side. So the belly of the muscle is running along my arm this way. You would then shake the muscle side to side. In order for these two techniques to be most effective, the muscle needs to be very relaxed. So if someone's making a muscle, right, and it's all nice and firm, you're not really going to get much work on that muscle. You need the muscle to be very, very loose and flaccid. Then we can get a good jostle or a good shake in. We can also use active joint movements. Active joint movements are movements that you tell the client to do and the client does them themselves. So if I tell you, raise your arm up and then bring your arm down. Now raise your arm up and bring your arm down. And the client is listening to you and they are doing what you tell them to do. That is an active joint movement. The opposite would be passive movements where the client turns into a rag doll and the therapist takes their limb and moves it around for them. Okay, so these are general techniques. We have compression, deep pressure, transverse friction, shaking, jostling, and active joint movements. Do we have any questions about what we've covered so far before we move ahead? Okay. So the next thing, sorry. All right, so the next thing we're going to look at are the general applications of athletic massage or sports massage. There are three basic applications for sports massage, and they are event massage, training, and rehabilitation. We're going to take a look at each one of these. Now, event massage, as you would guess from the name, is basically done at the time of the event. These are further broken down into 3 subtypes. So event massage, we have pre, intra, and post. Pre-event massage is done just before the athlete competes in their event. Intra-event massage is done during the performance. So let's say you have a swimmer and they're swimming in several different heats in the day. So in between their swim sessions, I don't know what to call them. In between their swim sessions, you would give them a quick like chair massage or a quick sports massage, so that in between the times that they have to perform, you're keeping them loose and you're improving circulation. Post-event massage comes after the event. So now that the day is done and they've swam all their day or they've done whatever their event is, now we're going to massage them after the fact, help cool the body down. Training massage is done during training. So this is going to be done while they're still training for the event. This is not done at the time of the event or on site at the event. This is done in the months leading up to it. This is going to be your most beneficial. So if you're trying to get clients in for sports massage, this is the one you want them to focus on. This is the one that will have the most beneficial effects, because training massage helps them train longer. It reduces their chance of injury while they're training, and if they do get injured, it reduces the amount of recovery time that the athlete requires. So training massage is going to be your most effective. In the event that the athlete does become injured, we would then use rehabilitation massage. Rehabilitation massage is specifically geared towards reducing the recovery time so that they recover more quickly and they recover with less chance of re-injury. There we go. So moving on to page 695, your book is now going to take each of these and talk to you about them more in depth. I've basically summarized them for you. But under pre-event massage, there is one highlight that I want you to get. It is in the second paragraph under the heading, pre-event massage. Highlight, pre-event massage is in addition to a proper warm-up before a performance and helps prepare the athlete for an all-out competition. This is important, you guys. A pre-event sports massage is not a replacement for their warm-up routine. They've got to warm themselves up. They've got to do some cardio or something to get their heart rate up, get blood flowing to the muscles. We can assist with that warm-up by doing pre-event massage, but we are not a replacement for it. We are an adjunct to it. It's very, very important that we remember that. For the intra-event massage, this one picks up on page 696. I want you to highlight the last sentence in that paragraph. As with pre-event massage, intra-event massage is fast-paced and avoids sedating the client. Guys, the purpose of event massage is not to relax them, right? When you get off the table from getting a Swedish massage, you're almost a little drunk, your hair's all messed up, and you just want to go find a big comfy bed and take a nap. Sports massage is so different. When you get off the table from a sports massage, your heart rate is up, your muscles are primed, you get off with energy, man. You're ready to run, you're ready to swim, you're ready to go do something. You've got all the energy you need right now. That is what we're trying to accomplish. Sports massage is not meant to be sedating. It is meant to be stimulating. So the strokes are fast-paced, right? You're not doing long, slow, relaxing strokes. We're talking about it is quick. It's a lot of tapotement. It's a lot of shaking. It's a lot of like beep, 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 boom, 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 shake them up, ready, and go. Pre and intra have to be fast-paced. If you start sedating your client, you're going to hinder their performance. They can't push themselves as hard as they need to if they're massage drunk. Now, the sedating side of things does come into play with post-event. after they've competed, right, they go through their cool down process. Under post-event massage, I do want you to highlight the first sentence. In the post-event massage, movements are aimed at flushing out the areas of the body that have been used during the event. Post-event massage will be a little more rhythmic, a little more slow paced. This one is trying to sedate the body, kind of calm them down, get their heart rate back down to normal. When you're bringing in an athlete to do a post-event massage, I like to have them sit down on the table and take off their shoes. This is one thing, it's kind of a psychological thing. When you take off your shoes, it signifies that you are done competing. But it also helps me see if they have any blisters or abrasions, any kind of injuries to their feet. It's also a good idea to continue light conversation throughout the post-event massage because, again, talking to them switches them out of competitive mode back into more of a cool down mode. Yeah. So your post-event massage is going to concentrate on those muscle groups that that client used. So if you're working on, say, I don't know, let's say you're working on a competitive ping pong player, legs and feet probably are not going to be your first priority. Probably neck, shoulder, arms would be your top priority. If you're working on a golfer, hips, shoulders, elbows. Now, if you're working on a swimmer, almost every muscle group is used in swimming. So you would have to do a full body, or at least pay certain attention to certain parts of the body. So page 697 starts giving us questions that we should be asking our clients, whether they're coming in for a pre-event massage or a post-event massage. These questions are important. You know, what is your event? What kind of sport are you playing? How often do you work out? What is your training regimen like? Do you have any injuries? Do you want me to focus on anything? These are relatively common questions, but we need to have an understanding of what they're doing, how hard they're training, what muscle groups they're using. Most of the time, they won't volunteer this information. You got to pull it out of them. So you got to ask them lots of questions so that my massage can be as effective as possible. I don't want to waste my time working on your legs and then you tell me, oh, well, I'm a competitive ping pong player, so all my tension is in my shoulder and arms, and I just spent 30 minutes on your legs. Now, on the next page, we have some procedures. You guys are not going to learn massage by looking at a series of photos and reading instructions. That is just not how we do things. Massage is best learned in a hands-on room where you put your hands on somebody and you learn the techniques and how to do it. So good read, it's good information. I'm going to move along. We're going to skip ahead to page 703. Page 703, we are talking about the benefits of training massage. I just said a few moments ago, training massage is the most beneficial, right? It's really nice to get a massage at the event that you're performing in, right? Either before or after. It's really good to get sports massage after an injury, but training massage will help prevent injury and it improves your performance because you're building up those cumulative benefits the whole time you're preparing for the event rather than just getting one massage right before the event. So on page 703, I want you to highlight training massage, also called restorative or preventative or maintenance massage, is the most beneficial form of massage for an athlete. It is considered a regular and valuable part of the training regime and allows the athlete to train at a higher level of intensity, more consistently, and with less chance of injury. Keep highlighting. Training massage enhances local blood and lymph circulation, which allows more efficient oxygen and nutrient supply to the cells, as well as more efficient removal of metabolic waste. It helps to identify and address areas of tenderness and restriction. So again, if we can start reaping the benefits of the massage way early in the process, right? Months before the athlete actually has to perform, then we can not only increase the metabolic rate of those muscles, we can improve their delivery of oxygen and nutrients, we improve their removal of waste products, but we're also able to help them tighten and tone as they work out. We're able to begin breaking down adhesions in the muscle tissue, making sure that those muscles are supple, they're able to contract fully, they're able to stretch fully. We get the maximum range of motion out of every joint that we're working on. This gives them a lessened chance of injury, and if they already have an injury, then we're reducing their chance of re-injury. So there are a lot of benefits to training massage. Training massage maintains the muscle in the best possible state of nutrition, flexibility, and vitality. So the techniques we will use with training massage are pretty much going to be the same as we would with any other type of sports massage. But what we need to know are what kind of sports the athlete is involved in, what their areas of concern are, if they have any previous injuries or surgeries, what their workout schedule is, and what their upcoming competitions are, so that we know how much time we have to work with them, and the extent that athletic massage is going to be incorporated into their training, right? I'm not going to be super detailed if they're only going to come to me once, right? I'm going to give them a general sports massage. But if I know that this person is incorporating massage as part of their training, so every other day, 2 or 3 times a week, they're going to come in to get sports massage, I can afford to be much more detailed because I'm going to have more time with them. But if you have less time or a lower number of sessions, you got to be more general. You're not going to be able to spend an hour on a shoulder or an hour on a calf if you only have a handful of sessions with them. Being aware of the client's previous injuries can also clue you into some of their trouble areas. Often an injury occurs because a muscle isn't flexible enough or it's unable to let go. Trouble areas also indicate fascia that could be stuck or bound together. And injuries, especially when muscle spasm or muscle tears exist, those injuries point to synergistic or opposing muscles as being primary or potential problems. So this is where it comes into play that we need to understand the agonist-antagonist relationships, right? The prime movers and the antagonists. Because if one of these is weakened, then the other one is going to be too strong and will overpower them. This leads to an imbalance in the strength of the joint. This can lead to overall body imbalance, literally being off balance. This could lead to injury or to overstraining muscles. It can lead to a lot of bad things. So making sure that we are treating the muscles, we're spotting any patterns that may be arising. And these are things that you develop an intuition over time. But if you need to go back to muscular system and revamp yourself on the agonist-antagonist relationship, it certainly helps, especially when you're getting into therapeutic modalities like sports massage. You really got to know your stuff when you start trying to treat these kinds of injuries or disorders. So what are the goals? What are the goals of training massage? Your book lists 3. I want to make sure you highlight all 3 of those goals. Highlight goals for training massage vary according to the needs of the athlete, but can include the following. Identifying and releasing hypertonic or spasmed muscle. Hypertonic is our fancy word for tight. The muscle's too tight. We got to loosen it up. Identifying and releasing fascial constrictions caused by repetitive stress or previous injuries. And enhancing or restoring flexibility or range of motion. So there we go. Loosen the muscle, loosen restrictions, increase flexibility. Boil it all down, help them move more easily. Help the person move more easily. This is what we're trying to do. Generally, massage sessions are done in a clinical setting where the athlete disrobes and they are draped the same way that we would drape them for a Swedish massage, but our techniques are going to be a little more aggressive. They're going to be a little more fast-paced. And again, when that client gets off the table, they are generally not sedated. They are generally a little more stimulated. Okay, good stuff so far. Any questions, you guys? Okie doke. At the bottom of page 704, the next section is tender points. I want you to highlight that entire paragraph. Muscles often contain tender points that are located either in taut bands in the muscle body, which are trigger points, or where the muscle ends and joins the tendon or the tendon sheath. The musculotendinous junction is where fascia and connective tissues are more prevalent. Because many muscle fibers terminate here, this area is vulnerable to strain, microtrauma, and the subsequent development of adhesions and fibrosis that become tender stress points. This is also where the ratio of blood vessels to tissue is lower, and therefore where fatigue occurs first. When a muscle is painful, the first indication appears in these areas. Now, if I haven't said this to you guys before, I'll say it to you now, and if I have said it already, listen up because it's important. We just dropped a really big word in the text right there. We said, where did that word go? Musculotendinous junction. Musculotendinous junction. That word is like a half a mile long. When you're learning anatomy, you will see a lot of very large words. It is important that you guys remember, words are our tools. They are not our masters. Medical terminology is a language that was designed to make sense to people. It was meant to elicit clear meanings and do away with misunderstanding or misinterpretation or fuzzy language. So here what I have drawn, you have the belly of the muscle turning into a tendon attached to a bone. When we talk about the musculotendinous junction, we are talking about this area where the muscle becomes a tendon. That's all we're saying. On those muscle diagrams, right, you see the full body, all the muscles, and then those muscles are turning into white tendons. Whatever point that red muscle turns into white tendon, that is the musculotendinous junction. It is a big word, yes, but words are our tools. They are not our masters. You don't be intimidated by big words. We break them down and derive some kind of meaning from them. Medical terminology is never intending to fool you. We will never name something that it doesn't correlate to what it is. So please do not be intimidated by big words. Break them down, derive a meaning. 95% of the time, you'll be dead on the nose. Okay. So we are going to move ahead a little bit more. Remember, you guys do need to read this chapter. I am just moving through, giving you guys highlights, key points, but you guys do need to remember to read this entire chapter because I'm skipping around a little bit. I do have an important highlight on page 706. I want to make sure that you guys get it. It's in the yellow box. It says massage caution. It is contraindicated to do deep strokes along dense fibrous tendons, like the Achilles tendon on the back of your ankle. This is because it tends to aggravate abnormal conditions such as pulls or tears. So working too deeply on a very dense tendon, if the tendon was already damaged, you could aggravate it more. Remember, we never want to exacerbate or enhance an injury, right? Do no harm. It's the highest rule in massage. Do no harm. All right. So next, your book goes into procedures for dealing with injuries on specific areas of the body. So we've got ankles, we've got front of the leg, we've got runner's cramps, we've got hip, leg, and buttock. I'm not asking you guys to remember specific procedures for certain areas, so we are going to move on through all of this. Now we are going to pick up on page 712. So we're talking about athletic injuries. What kinds of injuries are we likely to see when we're working with athletes? It's not surprising to know that when you're doing a certain sport using certain muscles, you're more prone to injuries of those muscles that you're using. So most athletic injuries are the result of trauma. Usually you've come into contact with another athlete or a fall or something like that. Or it's a result of excessive repeated stress to the same area of the body, repetitive stress. So on page 712, we're going to start highlighting in the second sentence, we're going to highlight the remainder of that paragraph. Traumatic injuries are often in the form of broken bones, dislocated joints, and torn ligaments. Injuries of the second type are far more common and generally affect the soft tissue in the form of muscle strains, pulls, and tears, or injuries to tendons and ligaments. These are usually the result of fatigue, overtraining, poor tissue integrity, muscular weakness, imbalance, or biomechanical deviation. Most of these injuries are preventable and treated by massage and proper training. So when we look at athletic injuries, we could group them into categories. We categorize them based on their onset and the duration of the injury. And if you guys have been paying attention throughout your beginning stages of massage school, this categorization will not take you by surprise. How do we categorize soft tissue injuries? We categorize them into chronic and acute. Highlight: chronic injuries have an indefinite onset. They can linger for weeks or months and can be the result of repeated injuries to the same area. When we say an indefinite onset, it didn't all just start at once. You had little hints of an injury here and there. It was a slow, gradual development. These injuries can last for a really long time, and usually we're looking at examples like tennis elbow or shin splints. Acute injuries, on the other hand, have a sudden and definite onset. They happened in an instant, like a broken bone or a pulled muscle. You know instantly something is wrong, you just hurt yourself. Highlight: acute injuries have a sudden and definite onset and are usually of relatively short duration. These usually only last a matter of days to weeks, whereas chronic injuries can last weeks to months. Examples of acute injuries are dislocations, sprains, lacerations. A laceration is a fancy name for a cut, like a deep cut. Bone fractures, contusions. These are acute injuries. Highlight: strains involve tearing of the muscle tissue or tendons. Sprains involve ligaments or joint capsules. The words strain and sprain are not interchangeable. They are defining the tissue that was damaged. Here is my little secret to try to remember the two. It's not the best secret in the world or best little trick in the world, but it works for me, and I hope it works for you. I use these words to remember the difference. Lisp and must. Must, you have a muscle, muscles get strained, muscle strain. Ligaments experience sprain. So lisp and must helps me remember the difference between muscle strain and a ligament sprain. It's a simple little trick, but I like it. My brain works with like wordplay and like moving letters around and stuff. So tricks like this work really well for me and my brain, but if it doesn't work for you, there are other ways. This is just what works for me. So when we are looking at muscle strains, we categorize them based on the severity of the injury. We categorize them into 3 grades. We have grade 1, grade 2, and grade 3. If you absolutely must have a muscle strain, you want a grade 1 strain. This is going to be some overstretching of the tissue. There's not a lot of damage. It hurts, but you still have full range of motion. You still have full strength available. You lost no function. It just hurts. With a grade 2 strain, you have some tearing of the tissue, usually less than half, but there is tearing of the fibrous tissue. It will be swollen. There may be some discoloration. Your book uses the word discoloration. It's a bruise. It's going to be bruised pretty badly. And you may lose some range of motion or lose some of the strength in that area. Now, a grade 3 is going to be the actual worst. You do not want a grade 3 strain if you can help it. There will be immediate pain, severe or complete tissue rupture. A grade 3, you could have torn the entire muscle completely in two. There will be extensive swelling and tissue deformity. When you tear a muscle, it doesn't keep its shape. You usually, like a torn bicep, you'll see a big dip in there. It looks like someone took a big spoon and just carved a scoop out of that muscle. When the muscle is torn in this way to this extent, there is no strength, there is no range of motion, right? You lose function in that joint. Just like a marionette puppet, when you cut the strings, right? That puppet doesn't move once you cut the strings. Muscles are your strings. And when you've completely torn a muscle, that muscle cannot function to move the joint anymore. You have lost movement. You have lost function. Now, the good news with injuries like this is the body heals itself. That is just what the body does. It is very, very good at healing itself. Under massage for athletic injuries on page 713, I want you to highlight the first few sentences. Highlight, massage directly on acute injuries is contraindicated. We do not massage acute injuries. When they are still red and swollen and painful, you leave them alone. For those kind of injuries, we want to use proper prompt first aid. But sorry, I dropped my marker. Also, not but. First aid for acute soft tissue injuries such as sprains, strains, and contusions involves PRICE. So the PRICE method is protect, rest, ice, compress, elevate. Let's take these one by one. Protect the area. So like if I hurt my elbow, you want to like maybe not leave your elbow like hanging out the car window. You know, you generally protect the area. Keep it safe from further injury. Rest it. Take it easy on that joint. Try not to put too much wear and tear, too much strain on it. Give it some time to rest and heal. Ice the area. This will reduce the inflammation and reduce the pain. Apply compression to the area. Not the massage technique compression. We're talking about a really, really tight bandage. Again, the compression creates pressure, which reduces inflammation. The last thing we want to do is elevate the tissue. Elevate it above heart level. The goal is you want the blood to have to go uphill to reach the injury. Reducing the flow of blood to the area will reduce the inflammation and thereby reduce the amount of pain and secondary damage to the tissue after the injury. Now, we've talked about acute injuries. The next thing we're going to talk about are chronic injuries. We're moving on to page 714. Chronic injuries have a gradual onset. They tend to last for a long time or they recur often. Frequently, they are the result of repetitive stressful activity. They are sometimes labeled overuse syndrome. You can pause highlighting right there. So if we repeatedly stress the muscle, we cause microscopic lesions in the connective tissue of the tendons and muscles. This in turn causes local low-grade inflammation. Examples of chronic injury highlight this. Examples of chronic injury include chronic muscle spasm, tennis elbow, shin splints, tendinosis, fasciitis, and iliotibial band syndrome. Now there's a couple of things I just want to throw a couple of tidbits of knowledge at you guys. You may get questions on the MBLEX about injuries like this, so I just want to kind of arm you with a little bit of extra knowledge. There are two conditions that are very similar to each other. We have tennis elbow, we have golfer's elbow. Both of these conditions are an overuse syndrome. It's a repetitive strain injury. Tennis elbow is caused by your extensor muscles as you backhand the tennis ball with the racket. Golfer's elbow is repetitive strain from the way they swing the golf club. Now, both of these conditions are caused by the same kind of thing. It is an overuse syndrome. The actual damage to the tissue is the same. You are looking at inflammation along the muscle insertion. What is different is where the problem is happening. The medical name for tennis elbow is lateral epicondylitis. So, if you remember your bony landmarks when you learned about arm and shoulder muscles, the distal portion of the humerus has two bony bumps on either side. Those were the medial and lateral epicondyles. The extensor muscles that originate at the lateral epicondyle through repeated backhanding action, those muscle attachments become overused, they become swollen and painful. That is lateral epicondylitis, or tennis elbow. Golfer's elbow is the same condition, except it happens at the medial epicondyle because you're moving your arm in the opposite direction. So golfers get medial epicondylitis. Let me write that up here for you guys. Golfers get medial epicondylitis. Tennis players get lateral epicondylitis. I am almost certain you guys will see some question about one of these two on your MBLEX. So if we have a client who is struggling with a chronic injury, something like tennis elbow or golfer's elbow or tendinosis or IT band syndrome, what we want to do is use our classic massage movements. So compression, we're using firm pressure, we're using shaking and jostling. We're trying to increase circulation in the local area, promote relaxation, and integrate those injured and compensating structures into the whole body. So active and passive joint movements, we're talking about resisted movements, we're talking about anything that we can do to increase the flow of blood and increase the range of motion and the flexibility of that joint. Now, as we look at these injuries, whether acute or chronic, soft tissue injuries are almost always caused by the same thing. To put it mildly, basically, soft tissue injuries are the result of overstretching and eventual breaking of the collagen fibers in the connective tissue. So the collagen gets overstretched, it tears, and now we have to repair. Whether it is micro trauma in between muscles or strained muscles, or we're talking about torn ligaments like an ankle sprain, stresses to the connective tissue exceeds their strength, resulting in tearing. That is the soft tissue injury. You applied more force to the tissue than the strength of the tissue, so the force damaged the tissue. When you damage muscle tissue, that tissue will undergo its normal repair process. This process begins with inflammation. Now, inflammation by itself is not bad. It is a protective response. Generally, it's very good. The problem comes when that inflammation is maintained for a period of time. Inflammation should only be allowed to happen for a matter of minutes to hours, and then we've got to bring it down, right? We want to use the Price method. We put ice on the area, we compress it, we elevate it above heart level. You try to reduce the inflammation as quickly as possible. The problem is with inflammation, you're not only bringing fluid to the area that creates fluid pressure, which triggers pain receptors, so it hurts, but what you're also doing is bringing a bunch of fibroblasts that will start to lay down new collagen fibers. We've got to get this tissue loose and supple because those collagen fibers will turn into scar tissue. Scar tissue is not loose. It is not pliable. It holds everything in place. It's very, very good at its job, but the body doesn't need to be held in place. The body tissues need to be loose and able to move around. So we don't want hard, firm scar tissue to develop at the site of the injury. We want that scar tissue to be loose and pliable. Okay. Do we have any questions over what we have talked about so far? Cool. So we're going to move ahead to page 718. This is the last page in this chapter. I've got two highlights for you in this section. So we start out by reading. The athlete's physician, employed by the organization or school, takes case histories and is responsible for pre-season evaluations and for advising the athlete on health care and the care of injuries. Start highlighting. The physician treats illnesses and injuries and is responsible for the rehabilitation of the athlete. The massage therapist or athletic trainer works under the direction of the physician and follows her guidelines when massage is to be part of treatment or rehabilitation of injuries. Pause highlighting. So the physician or the practitioner avoids doing anything that might make us liable or subject to malpractice. Negligence is defined as an imprudent action or a failure to act properly or a failure to take reasonable precautions. Athletes understand that there is always some risk involved and that a physician or a therapist is not held liable for poor judgment on the part of the athlete. However, highlight, athletic massage is contraindicated in any abnormal condition, acute injury, illness, or disease except as advised by the client's physician. So, almost anything that would contraindicate standard massage also indicates or contraindicates sports massage. We're looking at any abnormal condition, acute injury, right? We've never massaged acute injuries. That has never been a thing the whole time we've been in school. Sports massage is no different. If it is red and swollen and painful and it hurts, we don't touch it. That tissue needs to heal. We're going to send them home, tell them to put some ice on it. Once the swelling goes down, now they can come back and we can start with the massages. Any illness or disease, it's not the time for athletic massage, right? Remember, athletic massage is much more fast-paced, it is much more intense, it is much more stimulating. It is not sedating. They do not go to sleep after a sports massage. They get up and want to run a marathon after a sports massage. But generally, anything that would normally be a contraindication for massage is also a contraindication for sports massage. All right. So we have run through this chapter pretty quickly. I was expecting it to take about 2 hours. It took a little over 1. But this is everything that we have to cover on our list for today. So, with that being said, does anybody have any questions over anything we've gone over so far today? One at a time, guys. Okay. Well, if there are no questions, then I will let you guys know the activities for this week are up on MindTap. Check your calendar icon and see all the activities you need to do. We are covering sports massage and myofascial. Myofascial is taken out of chapters 15 and 17. So, no, I'm sorry, just 15. I'm sorry, not 17, just 15. Part of chapter 15 and sports massage from chapter 18. This is what we're doing this week. So you guys know my phone number. You guys have my email address. If you have any questions or issues, please reach out to me. I'm here to help. And that was my lecture. Thanks for joining us. All right, so if you guys don't
Thank you, Dave.
Oh, my pleasure. If you guys don't have any questions, enjoy the rest of your afternoon. Stay safe out there, and reach out to me if you have any questions or problems. I'm only here to help.
Appreciate you. Thank you.
Of course. You guys enjoy your afternoon.
You too.